Hello everyone. The first episode of our Know Your Condition is frozen shoulder. So frozen shoulder is also known as adhesive capsulitis, periarthritis of shoulder. What does it mean exactly is frozen means the shoulder is frozen. Adhesive means like a sticky thing, like a capsule has been tightened over the shoulder joint. So this causes pain around the shoulder, restricted range of movements of the shoulder joint. Like this is called flexion, this is called abduction, external rotation and internal rotation. The most difficult movement for a patient with frozen shoulder is this movement, this one, and then comes these kind of movements, the inside, the outside. The prevalence of having a full frozen shoulder, I'm seeing more in women than men. Second thing is, in diabetic patient has been seen more, like around 20% prevalence more in diabetic patients. The patients having hypothyroidism, hyperthyroidism also have been shown to be more prone to frozen shoulder. Okay, now the causes of frozen shoulder are either primary or secondary. Primary causes, there is no such reason for primary cause, and the secondary causes are frequent dislocations of the shoulder joint, shoulder injury, fractures of the shoulder joint, and then post-stroke patients also have been shown to more prone to frozen shoulder because they don't do the proper movements of the shoulder joint. And so basically there are three stages of shoulder, frozen shoulder. Stage 1, freezing, frozen, thawing. So stage 1 is freezing stage. In this what happens, the patient complains more of pain around the shoulder joint and not any restriction to the movements. So pain around while sitting, while lying down, the time when he gets up in the morning, while doing the movements, the patient complains of more of pain. Then the second stage comes is the frozen stage. In this what happens, the patient complains more of a restriction of range of movement. So the movements are more restricted and the pain subsides a little bit. And these two stages stay for around 0 to 9 months. Okay, and the third stage is the thawing stage, in which the movements become better with time, the pain also reduces with time, but this stage stays for around 2 years or maybe 3 years. Hence the patient has to go for physical therapy, exercises, stretches, pain modalities, so the recovery rate is faster as compared to other people. Okay, now there are three signs or diagnosis, like how to see, three tests basically, how to see a patient is suffering from frozen shoulder. Okay, so the first thing is, ask the patient to lift the hand up, bring it behind the neck and touch his neck. See if the patient is able to do this or not. The second is, ask the patient to take the hand behind and lift the hand up like this and touch the opposite scapula. Then normally the patient won't be able to touch the scapula over here, this movement. Okay, it should be restricted to this. And the third movement is, take the hand and try to touch the opposite scapula. See how much is the range and is the patient able to do or not. So the patient mostly complains of pain, stiffness, little bit of range of movement, not able to lift weights, and those kind of problems the patient suffers. And the age group in which these things have been, the frozen shoulder has been seen as 40 to 60 years of old or above. And basically these are the things. And then the rehab. So basically what rehab the patient has to undergo, I will let you know in the next or some other video, and we'll end the first episode over here. Frozen shoulder. If you have any doubts or something, just let me know in the comment section. Thank you.